everybody. I'm Dr. Arcojit Ghosh, consultant physician and diabetologist practicing in South Kolkata and some areas of South Chobbish Pargana, also in some corporate hospitals in Kolkata. Today, I'm just going to talk about hypertension, a very common disease, a very common lifestyle disorder that is existing all around us. And it is highly prevalent. And I would always say that it is always underdiagnosed. What should I say about this is, what is this hypertension actually? So when the blood is pumped from the heart, it passes through the arteries. Now, while it passes through the arteries, it exerts a pressure on the lateral walls. It exerts pressure laterally on the walls of the artery. So when this pressure is higher than normal, when the pressure requirement is higher than the normal, then this hypertension actually develops. How it does is, see, it depends upon the age of the patient, because the higher the age, the stiffer the arteries are. That's actually a very raw way of saying this, but uh, the older the patient, the higher the stiffer the arteries are. Hypertension runs in families. Yes, for every patient whom we diagnose hypertension, we must take the family history also. It runs in families. Uh, there is excess salt intake in food, which can precipitate hypertension. And let me tell you, I'll just talk in details about this salt in food, and also eating processed food in large quantities, which actually has become a part of our lifestyle. So that also is very harmful. And also another thing is stress. So stress is actually a very important factor. And nowadays, no one can say that, especially the doctors, especially the ones who are working in IT sector, no one can say that we are free from stress. Everyone is in some stress or the other. So the best way is to minimize it, or to handle it in a much better way than we are doing it at present. So what can we do to prevent this hypertension, or what we can do to manage this hypertension? The first thing is regular exercise. Now, we hardly exercise these days because of the present work schedule, but we still have to find time to exercise, to find the right way, to find the right time to do some walking, do some gym, do some light exercises, so that we maintain the mobility of our body, and of course the various parts of our body in a synchronized manner. Okay, the next thing is healthy diet. Now, what is this healthy diet? For hypertension, we usually say that salt-free, salt-restricted, fat-restricted diet. Now again, where comes the glitch? Where comes the catch? Now, by salt restriction, a lot of people think that the extra salt which we add to our food, to our regular thali, is something which the doctors talk about. No, see, that extra salt is high. I accept it. See, 1 milligram of 1 teaspoonful of sodium common salt contains 2,300 milligrams of sodium. I'm not saying that it is too less, but that is not all. Let me tell you, gentlemen, the highest amount of salt is contained in the processed foods. So whenever the food is being processed, a huge amount of salt is added to it. Especially, if you go to a KFC, if you go to a fast food shop, if you go to a processed food shop, the products that you get over there, you cannot see that, but it contains huge amount of salt. The daily pickle which we take, the daily puffed rice or muri which we take, they also contain a huge amount of salt. So you have to tailor your diet in that way. Always check the labels of every foodstuff you are buying across the counter. To me, the most important thing is actually avoiding processed food. They contain humongous amount of salt. By asking about fat-free diet, now let me tell you that the most harmful fat is the trans fat. And trans fat is contained in all man-made foods. Just let me tell you what I commonly say to all my patients is anything that is kurkure and murmure. Okay, that contains huge amount of trans fat. See the biscuit you can get in a local tea shop. They actually become soft after some time. But the packeted biscuits, they remain hard for a good length of time. So anything which remains hard for a good length of time contains more trans fat. So trans fat needs to be avoided. Smoking needs to be quit, and alcohol intake also needs to be quit, because all these are harmful for lifestyle disorders. Now, what do I mean by this regular blood pressure measurement? I'm not asking you to measure blood pressure every 10 minutes, but check the blood pressure every 2-3 months. What do I mean by saying this is, let me tell you, the symptoms of hypertension are quite vague and they quite overlap with other diseases. They are just like a vertigo or a headache or nausea, vomiting. Now, these are very non-specific symptoms. So you just don't mix up these with others. Now, there are plenty of patients who have come to me and said, sir, I am having vertigo. I think I am having hypertension. No, most of them have not been diagnosed with hypertension. And let me tell you, the most common method of detecting hypertension is by measuring it. And majority of hypertension has been detected during routine clinical examination. Just when what we do when we measure the blood pressure of the patient during the routine clinical examination, hypertension has been diagnosed in these cases. So I would say keep in track, keep measuring the blood pressure. The next important thing is stress management. Now, stress management is just one kind of thing which you can do it yourself. You have to do that and plan that yourself. You cannot ask anyone to do that for you. Everyone has got particular stress, like family stress, job stress, everything is there. Now that you have to manage and you have to minimize it. The best way I would say is manage your work uh, relaxation balance. That is the best way to do it. Last thing is adherence to medications. Now, just let me tell you that when your hypertension will be diagnosed, you will be prescribed medicines, maybe single or a combination medicine. The most important thing you have to know is that medicine has to be taken lifelong. We do not cure hypertension. What we do is we actually keep the blood pressure under check by counteracting some physiological mechanisms. So what I would say is the best way is to stick to medications. Medications has to be taken lifelong because we do not cure blood pressure. You have to take the medication lifelong. The medication has to be taken in time. Wherever you go, wherever you travel, please carry your medications. If you are on tour, if you are on a family trip, please carry your medications for the required number of days. What is very important here is that the duration of action of most of the medicines is 24 hours. So if you miss the medicines for 2 or 3 days, what happens is that the blood pressure comes to it begins fluctuating. So that is very dangerous and that can precipitate a cardiovascular or a cerebrovascular event. So please stick to your medications. The better the adherence, the better the compliance, the better is the result. So thank you all for your kind attention and hearing, patient hearing. Uh, See you sometime later. Thank you.